Hi friends, let's come to an important decision that a lot of pregnant women and their partners have to take, which is whether to opt for an NIPT test or a non-invasive prenatal screening test, or whether to opt for a marker test. Now, why this dilemma is because if you look at the cost analysis, an NIPT test is around 2 times more expensive than the marker test. And hence, there's dilemma in a lot of patients' minds as to why the doctor is preferentially advising an NIPT test versus a marker test. The answer will be there in the following video for all of you to understand and then take an informed decision. So, both the NIPT and the marker are screening tests, which means that they screen you for various lots of genetic or chromosomal abnormalities that the baby might be having. If any of these screening tests are positive, the next step would be to go for diagnostic testing, which are 100% sure and based on which a decision to terminate or continue the pregnancy can be taken. So now, if both these tests are screening tests, then why do we ask for one test in preference to the other? This is because a marker test or a dual marker or a double marker test is going to check for 2 hormones that are present in your blood when you are pregnant with a baby with genetic abnormalities, and these are present in a specific quantity. Based on the analysis of these quantities, we come up, or the laboratory comes up with a risk ratio which will be either low risk, intermediate risk or high risk of this baby having any of these common genetic or chromosomal abnormalities. Talking about the NIPT test, this test is going to pick out something called as a free floating fetal DNA from the mother's blood. This DNA is belonging to the baby that you are carrying, and hence, because this directly tests the baby's DNA from your blood and comes with an analysis of if any chromosomal abnormalities exist. This, as you can understand, is a more direct form of testing, and hence it is almost 100% or 99% specific and sensitive for the common chromosomal abnormalities. Most of the times, these screening tests are going to screen for trisomies such as trisomy 21, which is commonly known as Down syndrome, trisomy 13, trisomy 18, and Turner syndrome. These are the abnormalities that are present very commonly, and hence it is advised that these should be screened for. Especially if a woman belongs to a background where she is above 30-35 years of age, where she's had family members previously who have been affected by some kind of a genetic problem or a chromosomal problem, if she has been in an environment full of radiation, she has been taking certain medication that are hazardous or are known to cause certain fetal abnormalities and malformations, all these women must get an NIPT test done as a screening test. But of course, if the affordability factor can be nullified, definitely we would recommend an NIPT test for everybody else who can afford it, because it helps us to rule out or screen women with a higher chance of having a baby with a chromosomal abnormality. If we find this abnormality, we can take a decision to terminate the pregnancy earlier in a pregnancy which is less than 20 weeks, and hence the problems and the complications that arise from a delayed or a late miscarriage or a late termination of pregnancy are much reduced. I hope you find this information helpful and a lot of help in taking your decision whether you wish to take an NIPT or a marker test. Most importantly, if you find this information useful, don't forget to like, comment and subscribe to our channel so that we are encouraged to come up with more topics that can help you.